Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss the Conservative claim that NHS waiting lists are falling, and falling by large numbers. However, the reality is there is no evidence that they're falling at all. So let's look at the claim, first of all, and then look at the data. The Conservatives are claiming the biggest 6-month fall in NHS waiting lists, but then in quite small print, it's really small print, they say, you can see it says, in 10 years. And you think, they had to add the 10 years because they wouldn't want to get called out for the fact the steepest drops in waiting lists were under the last Labour government. Now, in terms of the specific claim, yes, it's one of these lies, damn lies and statistics. It is indeed the biggest 6-month fall in 10 years, and yet waiting lists have still increased. And you think, hang on a minute, Phil, hold on. That's confusing. How can waiting lists be falling and rising at the same time? Well, it's simple. Because there's a seasonality about NHS waiting lists. You know, if I wanted to say it's warmer this year than last year, nobody would take me seriously if I compared the temperature in May this year with the temperature in February last year. But that's what the Conservatives are doing here. You can see from this chart of waiting lists for consultant-led elective care, which is the waiting list NHS England often publish. Actually, this is slightly more, but more on that later. You can see that each year there's an ebb and flow. The waiting list goes up and down. So a real comparison should be from 1 month to the equivalent month of the year before. So they shouldn't be doing a 6th-month comparison of waiting lists. It should be a 12-month comparison. In March of this year, the waiting list was 7.54 million. Last March, it was 7.33 million. So there were an extra 200,000 people on the waiting list this March, just gone compared to last March. So the waiting list has actually increased. But that's not the end of the story. In fact, there are several other things which the public should really be made aware of, because I suspect that in a few months, a proper comparison from month to the equivalent month the year before will show waiting lists genuinely falling. And that is because Sunak raised them deliberately to record high levels as a result of not dealing with the strikes properly by negotiating, you know, for a very long time. It was a very long time before they even talked to them. Well, if you squeeze the supply of medical care excessively and then you release that pressure a little bit, of course you're going to see a reduction in waiting lists. However, those waiting lists are still far too high and far higher than they were even a few years ago. You know, this chart's actually quite good. It shows the last few years of the last Labour government as well as all the time of the current Conservative government. So even though Labour had already been in power for 10 years at the point this chart begins, they were still driving waiting lists down. It shows just how long something like this takes. And it's going to take the next Labour government a long time as well. From August 2007 to August 2008, waiting lists fell from 4.19 million to 2.68 million. As 1 year waiting list drops go, Sunak will never achieve anything like that because he's not been building up the NHS capacity to do so. In fact, should we compare anyway? So the Tories are wetting themselves because there's been this reduction in the waiting list of about 230,000 in a 6-month period from last September to this February. So at the end of the last Labour government, when they'd already cut waiting lists massively, during that same 6-month period, from September 2007 to February 2008, they managed an 880,000 drop. Same period. So yeah, you can see why the Tories are only talking about the biggest fall in 10 years. They wouldn't dare compare it to Labour's period in government. In fact, at around this time, famously, Tony Blair was being savaged by a Question Time audience. Oh yeah, he went to Question Time. Don't think Rishi Sunak's going to put himself in front of a Question Time audience anytime soon. But Tony Blair was being absolutely savaged. Why? Because people were being made to have an appointment with their GP within 48 hours of asking for one. Some people, for good reasons by the way, wanted to make their appointments for later. No, you've got to have it within 48 hours. Back then you were guaranteed an appointment within 48 hours, and this was annoying. Wouldn't we love to have that annoyance now? After that, we had the banking crisis, of course. So the waiting list remained at roughly that level, but it remained at that level. It didn't go up just because we had a massive recession. When the Conservatives came to power, Oh, it went up then. We can see it increased each year then, with an even more rapid increase after 2015 when the Conservatives were ruling as a single party. So any talk of the current waiting list being down to the pandemic are false. They'd climbed from about 2.5 million to 4.5 million before the pandemic. The rate at which it then increased after the pandemic was much greater, but that's because we broke our NHS. It was already climbing though. And the only reason there's any fall at all now is because the government artificially raised it even higher by inflicting real-term pay cuts during a cost of living crisis for NHS staff and then not negotiating with them, which resulted in long-term strike action. This was a deliberate mathematical trick. Keep the strikes going as long as possible, knowing full well it will cause waiting lists to climb even higher than would normally be the case. Then deal with the strikes in the year leading up to the general election so you can claim waiting lists are falling. It's a cynical trick which shouldn't work this time at least. Would normally. Labour will certainly be showing the chart of waiting lists under Conservative and Labour governments, and it has to be said that Labour enjoy a huge lead over the Conservatives on handling the NHS. They often do. But finally, there's something else which the public should also be aware of. There are different ways of measuring the waiting list. NHS England currently claims they have only somehow 6.3 million on the waiting list, which doesn't seem quite right. But anyway, the total number of people on the waiting list, according to the Office for National Statistics, as reported in the BBC, is 9.7 million. Now, this huge difference is down to not counting people who are waiting for a test or who have technically started treatment, but they are waiting for that follow-up care. And the problem with excluding certain types of patients from the figure is when NHS bosses are pressured to get waiting lists down, which they obviously are going to, what do? You focus your resources on those who are counted in the figures and you have to ignore those who aren't. Of course you would. That's what you've been told to do. The end result being that more people will wait longer for tests or follow-up care where there is a logjam in the system. They will try and rush people to start the treatment, but they won't rush the treatment itself because as soon as you've started the treatment, you're off the figures. Sod you. Let's focus on getting more people to start the treatment, but not necessarily complete it. Because you aren't counted in the politically important headline figures. Because another thing Labour did with waiting lists when they were last in power wasn't just that they got them down. They kept changing the definition of waiting list to include more patients. You know, they got the waiting list down. They said, hang on a minute, you know, we're not counting all of these people. Right, count all of these people. And every time they did that, there's a chart that shows this. I'm hopefully going to remember to put it up here. I sometimes forget. It will be linked in the description below. But there are different colours, and the different colours coincide with including more and more patients in the figures that were previously not included. And every time that happened, you can see with the difference in colour, the number shot up. But that's because they were including loads more people. But when they changed the definition, the waiting list was still coming down. You'd have this massive reduction. And then the Labour government would go, we're still not including everyone. Let's include more people now. You know, all the way, it kept reducing all the way till 2010. And then it went up. And it's gone up ever since 2010. I wonder what happened in 2010 to reverse this trend. But anyway, there we are. The Conservatives have nothing to crow about. They've deliberately raised waiting lists very high, just so that they could drop them a bit before the election without actually improving the NHS. They've been increasing waiting lists every year since coming to power, where Labour were lowering them every year after they came into power. They are, or at least keeping them level. They are cynically excluding about 50% of everyone waiting for treatment from the published figures in order to make the situation seem not as bad as it really is. The Conservatives have always opposed and failed the NHS. They want it to collapse. They want to replace it with an American-style private insurance system whereby over 250,000 people a year become bankrupt in order to pay for medical treatment, where many more people cannot even hope to get that medical treatment, so they die or suffer long-term healthcare problems. That's what they want. Some Conservative MPs are even saying so out loud. The public should probably be aware of this as well. But there we are. Those are my thoughts. If you enjoyed the video, please subscribe for further content and click the like button. You can also sign up for memberships if you'd like to support the channel further. Thanks for watching, and until next time, I'll see you later.